Hello and welcome to this important discussion on vaccines, fertility, pregnancy, and breastfeeding, hosted by the Calgary Health Foundation. My name is Valerie Ball. I'm the Director of Communications here at the Foundation, and I'm pleased to be your host for this evening. We are in for a very interesting conversation, and hopefully you get answers that many of you are looking for with your questions. These decisions can be quite challenging, but kudos to all of you for showing up tonight to gain more knowledge and to ask the important questions to help you make an important decision. There is a lot of information out there, and we are pleased to have you join us tonight to hear from our experts. Before we start, I want to share a little bit about the Calgary Health Foundation and why we do these education sessions. Calgary Health Foundation is a nonprofit that works with our 4 hospitals in the city, so Foothills Medical Center, Peter Lougheed Center, Rocky View General Hospital, and South Health Campus. We also support community health programs and long-term care in Calgary. And with the support of our donors, we invest in breakthrough initiatives and projects that are challenging the status quo. One of the important ways to do that is to create platforms for knowledge sharing with some of the city's top clinicians. So that's what we're doing tonight. Just a couple of housekeeping items before we get started. There's a Q&A button at the bottom of your screen. This session is about you getting information that you need, so please use it. And if you choose to use the chat, your questions will be public. We're going to get through as many questions as possible, and the event will be recorded and made available on our YouTube channel following this. Before we begin, it is an absolute privilege to first welcome Sandra Baker for our traditional land acknowledgement.
Hello, my name is Sandra Baker, and I am an educator with the Indigenous Wellness Corps. My grandmothers were Mi'kmaq and Acadian. I am a proud Métis woman. I was asked today to deliver this land acknowledgement for you, and I'm very happy to do so. When the blood in your veins returns to the sea, and the earth in your bones returns to the ground, perhaps then you will remember that this land does not belong to you, but it is you who belong to this land. I would like to take this opportunity to acknowledge the land in which today's speakers are delivering from, and myself as well. This is the traditional territories of the people of Treaty 7 region in southern Alberta. This includes the Blackfoot Confederacy, comprising of the Siksika, the Pekainai and Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wellesley First Nations. The city of Calgary is also home to the Métis Nation Region 3. A land acknowledgement is a formal statement that recognizes and respects Indigenous peoples as traditional stewards of this land and the enduring relationships that exist between Indigenous peoples and their traditional territories. Thank you. Merci. Welalen.
Thank you, Sandra. Tonight we have 2 leaders in the area of obstetrics and gynecology and maternal health. They are doing impressive work to understand and track the impact COVID and the vaccine is having in women here in our province. Dr. Eliana Castillo is a clinical associate professor at the Cummings School of Medicine here at the University of Calgary. Her medical and academic practice focuses on reproductive infectious diseases and implementation science. She's an emerging leader on vaccination in pregnancy and partners with patients to understand their journey during pregnancy, focusing on opportunities to engage in a dialogue about interventions that we know can protect mothers and babies. She works with the National Advisory Committee for Immunization, Society of Obstetrics and Gynecologists of Canada, and the Canadian Association for Immunization, Research, Evaluation, and Education. Thank you, Dr. Castillo, for joining us. We also have Dr. Vreni Kuret. She attended the University of British Columbia for her undergraduate degree in rehabilitation sciences. After 3 years of practice as an occupational therapist, a 6-month volunteer experience in Uganda convinced her to pursue a medical degree. She completed her MD training at the UBC and moved to the University of Calgary for her residency in obstetrics and gynecology. After completing her maternal fetal medicine fellowship training at BC Women's Hospital, she joined the maternal fetal medicine section at the University of Calgary, and most recently, she has taken up the role of Calgary Maternal Fetal Medicine Section Head. Her areas of interest are in maternal and fetal effects of infections in pregnancy. Thank you, Dr. Kuret, for joining us. And I just want to get started by thanking you both for taking the time tonight to our questions.
First, I just want to start by saying thank you so much for joining us this evening. Both Dr. Castillo and I have been busy trying to understand how this COVID pandemic impacts pregnant women all the way from the beginning of the first wave through until this evening, and we will continue to do so. And I have said this so many times, but it still holds true that with every step of the way, we learn new things, we discover new things. There is so much information and data coming at us that at times, whether I have my hat on as an obstetrician or as a researcher or as a mom of 2 kids here in Calgary, I sometimes find it really hard to sift my way through the information and struggle just like anyone else with making the decisions that we're faced with, things that we never really thought that we would have to think about. And so tonight, I'm just hoping that I can share some of what we have found, some of my experiences with you, and answer some of your questions, recognizing that we may not all be on the same page, but that's okay. That's why we're here, for an opportunity to dialogue together. What we're seeing right now with the 4th wave, I will say, is unprecedented. It's different than the other waves. The Delta variant is highly contagious, but it's also appearing to be a variant that is causing more illness and more severe illness in pregnant individuals. And so, to kind of put some context to that, the number of ICU admissions is far greater in the last 2 months than it has been in the entire year prior, from the start of COVID in March 2020. So in 2 months, we have managed to outstrip all of the admissions to ICU that we had from March 2020 until the end of June 2021. And that's a huge concern for me. I'm, on one single day, I might be rounding on 3 or 4 women intubated in the ICU, many of them having preterm deliveries by emergency C-section, intubated, and not being able to share in the joy of the delivery of their baby. So that's my real world, and that's why I'm here tonight, because we are seeing more emerge visits, more hospitalizations, more sick women. And what I have observed is that the women that are in the ICU intubated are those individuals that have not had an opportunity to be vaccinated. So those are some of the experiences that we have had recently. As many as are sick, there are still the majority of women that can manage COVID at home that have relatively mild disease, and for that I'm incredibly grateful. But we are worried with the increasing trend that we're seeing in women admitted to hospital.
Thank you for that. I think that it's important to gain a little bit of perspective of where we're at right now. And so I really appreciate you sharing that. And I also appreciate everybody for hanging on with us at the beginning here, as we had some technical difficulties and we're just catching up now. So I really appreciate everyone's patience with that, for sure. So I guess just building on where we're at today, we've acknowledged that there's lots of information out there. There's a variety of information. And I think one really common area that there's a lot of conversation happening around is miscarriages. And so I want to dive a little bit in here. And how does the vaccine affect early pregnancy? And maybe you can describe a little bit about how the vaccine actually interacts with the body so that we understand what's happening when we get vaccinated. Dr. Castillo, why don't you start here?
So the mRNA vaccines that are the vaccines that are recommended for pregnancy they work by telling our body to make protection antibodies against the coronavirus. And the way they work is that when a mother or when someone gets the mRNA vaccination and gets it in the arm, the vaccine itself does not get into the bloodstream. The vaccine goes from the muscle, right, where the needle goes, into the lymph nodes that are the factories for antibodies. And then once the vaccine gets to the factory, it tells the immune cells to start making the antibodies against the spike protein of the coronavirus. And then those antibodies are the ones that get on the bloodstream and that can get to baby. So, very important point to take away from this is that when a mother gets vaccinated with the either of the mRNA vaccines, the vaccine itself does not get to baby. The vaccine itself, the tiny amount of the vaccine goes into the lymph nodes, and the antibodies, the protection itself, that's the one that gets on the bloodstream, and that's the one that gets to baby. So, and we have good data to show that the vaccine itself is out of our systems in a matter of 7 days. So that's more or less how we have seen the vaccines working. So takeaway point for mothers: the vaccine does not get to baby because it does not get into the bloodstream. The protection antibodies that we make naturally in response to the vaccine, those are the ones that get to the bloodstream, and once they're in the bloodstream, they go through the placenta and go to baby.
It's a really good starting point to take a little step back first and say, okay, what do we know about miscarriages in general in pregnancy? To remind ourselves that unfortunately, miscarriages are more common than we actually think. So when you look at the baseline rates of miscarriage, about 15 to 20%, or 1 in 5 pregnancies result in a first trimester miscarriage. Most of these these miscarriages happen spontaneously. It's not that the pregnant individual has done anything wrong. It is simply that nature is not perfect. And in fact, when studies have looked at the products of conception or the tissue from the miscarriage, about 50% of those early miscarriages actually have abnormal chromosomes or genes in them. And so again, nature is sort of ending a pregnancy that may not have progressed normally on its own. So I would say starting at that point, having an early miscarriage, and when I say first trimester, I mean in the first 12 to 13 weeks, is pretty common. It's just something we don't talk about. Miscarriage, it's never something anybody wants. It makes us incredibly sad. And so it's something we just don't talk about very much. But if you do start asking the question, or if you confide in some of your close friends or family members, you'll probably realize that many people have had miscarriages that you might not even know about. So when we then say, okay, if that's our baseline, then let's look at the sort of the emotion around miscarriage. I counsel women all the time who either present to the emerge with bleeding and we diagnose a miscarriage, or I see them in an ultrasound clinic because they've come for a dating ultrasound or a first trimester screening ultrasound, and unfortunately we see that there's no fetal heart rate, or she's had some bleeding and cramping, and most women want to know why. And it's very common that we associate something that we've done in terms of timing and when we have the miscarriage. So, oh, I was super stressed out at work. Did that cause the miscarriage? Or I ate some deli meats in my sandwich. Could that have caused the miscarriage? It's very common. We want an answer. As women, I think we're really hard on ourselves and we feel this sense of responsibility. So when you take all of that around miscarriage and then you apply that to the concerns around COVID, I get it. I get where people are coming from. People want to do the very best that they can, and there is concern that this is a treatment that may induce miscarriage. When we first started learning about the vaccines, the original trials, and I'm talking about the mRNA vaccines here, so Pfizer and Moderna, because that really, those are the vaccines that are recommended in pregnancy, and those are the only ones available to pregnant women in Alberta. So the original studies that were done, the safety trials before these vaccines became largely available, did not include pregnant women. There were some sort of unplanned or accidental pregnancies, and those numbers were small. So I would say when this vaccine first came out, we were cautious. We didn't have a lot of information, and there might have been practitioners, pharmacists, healthcare providers who said, you know what, if you're going to do this, maybe hold off in the first trimester. I don't think that was wrong when we first started, but now we have so much more information, and we've had, in the US alone, 350 million individuals who've received a COVID vaccine. And then there's also a really big registry called VSafe. It's publicly available. You can take a look at it. Over 150, close to 160,000 women who've received vaccines in pregnancy have registered. And from that large group of women, there are now studies that have looked specifically at the issue of miscarriage in women who got a vaccination in the first 20 weeks of pregnancy, so including that critical 12 to 13 weeks. And the studies, particularly this one that looked at close to, I think, 2,500 women, they did not find an increased rate of miscarriage. The miscarriage rate was 13%, but that's equivalent to what we see in the general population, regardless of vaccine, completely separate. So that's the information that we have now, which reassures me that both there is some scientific data and studies that are peer reviewed that tell us that there's no increased risk of miscarriage. And there's also now so many people that have received the vaccine that we should be seeing signals if they truly did exist. That doesn't mean that your friend or neighbor may have had the COVID vaccine and then 2 weeks later had a miscarriage, but that doesn't mean that it's related to that vaccine, because we know that this can happen in pregnancy.
Thank you, Dr. Kuret. And if I may say, there has been a lot of criticism about the first study that came out in May looking at the registry data. And some of the concerns about the data have been that, well, there was no comparison group. So basically, the investigators from the VSafe registry, took a look at the first, 2,500 patients who either got pregnant soon after getting the vaccine or got the vaccine kind of on the first trimester when there can be a miscarriage. So that was one of the criticisms. But just 2 weeks ago, a very important study was published at JAMA that included about 100,000 pregnancies. And it came from a database that where about 3% of the US population is registered, and it is a very diverse population. And in that study, they used what is called a case control methodology. So basically, they were able to compare women who were vaccinated with the mRNA vaccines and women who were not vaccinated. And they were able to compare the rates of miscarriages in the two groups. And basically, the risk of miscarriage was more or less the same, and it was about 8.5%. So that for us, well, and for me in particular, as a scientist and as a physician who have to have these heart-to-heart conversations with my patients all the time, it was incredibly reassuring because it was a very well-designed study where we have, where there was a comparison group, and not only the rates of miscarriage were comparable between the two groups, but also it was representative of a diverse population. So it wasn't only, predominantly Caucasian or predominantly Black. It was a good mix of the US population. So I think it just adds to the evidence that mRNA vaccines do not increase the baseline of miscarriage that any pregnant woman or any pregnant person has when they get pregnant.
Thank you. And I think you actually have 2 slides that show this from that study. And maybe, John, you can pull it up. And as a follow-up question, I'm just wondering if you consider babies born, stillborn, as part of kind of these rates or data. And the second question is, what considers vaccinated? So are these women that received 1 dose, or do they have to have 2 doses to be considered vaccinated?
So Val, I'll take the first question and maybe I'll let Dr. Castillo answer the second question. In terms of stillbirth would be considered in a separate group. So stillbirth, sort of in scientific literature and from an obstetrical point of view, is defined as a fetal loss after 20 weeks. So that would no longer be considered a first trimester miscarriage. And stillbirths information is being collected. Thankfully, stillbirth is a very rare event, and so we need to look at thousands and hundreds of thousands of pregnancies in order to be able to comment, because the rate of stillbirth is 1% or even less than 1%. Again, for all comers, in all pregnancies, an awful, awful thing that happens to families. So I don't know that I can comment yet on whether or not there is a link with stillbirth, but it is something that's being looked at, and it is something that is being looked at separate from the question around first trimester miscarriage.
And Val, to answer your question regarding vaccination, so if I understand correctly, you're asking, in order to be protected, do you need 1 dose or 2 doses? The answer is you need 2 doses. So a couple, 8 months ago, when the mRNA vaccines were licensed for emergency use and the baseline COVID variant was circulating, what the data showed is that 2 doses of either Moderna and Pfizer would protect between, up to 90 to 95% against severe disease. So getting sick enough that you would need to go to the hospital. With the variants of concern, so with the Delta variant, we know that protection with 2 doses of vaccine is not in the 95%, is lower than that, is around 80%. Still very good. So you need 2 doses of an mRNA vaccine to reach that at least 80% protection against hospitalization, intensive care unit admission, and other serious complications that would require medical attention.
Great. I think we're going to pull up the charts here, and maybe Dr. Castillo, you can just tell us what we're looking at pertaining to that study here. And
Okay.
just for clarification, my question as well as also is, are the women that were studied in a lot of the research you've done here vaccinated with the 2 doses? Or is there some crossover with women as well that had 1 dose?
There is a crossover, Val. So there is a crossover of people getting 1 and 2 doses. So this slide shows a table that compares the number of cases at the first, 827 women who were either pregnant on the first trimester or who got pregnant shortly after completing the vaccination, so getting the second dose, or getting 1 dose, and that's the one that shows frequency of miscarriage of 12%. And again, this was comparing against the baseline rate. That first look at the VSafe data, and again, that is at the first snapshot at the 827. Also look at other adverse outcomes, like for example, congenital anomalies. That is always a concern. Well, if I put something in my body in the first few weeks of pregnancy, when everything is forming, will we have, is there going to be a risk of congenital malformations? And what the VSafe data showed is that the percentage of congenital malformations was 2.2%, which is very comparable to what is the baseline percentage of congenital anomalies. This is the most recent study, again, coming from the United States, it was published in mid-September 2021. And this is the study that I was referring, that includes 105,000 unique pregnancies. And in those 100,000 pregnancies, there were 13,000 miscarriages that were basically equally distributed between the vaccinated and unvaccinated groups. So that, again, very reassuring to have this particular study. And in this study, more or less, the proportion of people that got Moderna versus the proportion of people that got Pfizer was very equivalent.
I think just to pick up on, I guess let's dive into pregnancy a little bit more. So lots of information out there for pregnant moms. COVID aside, you're given a ton of information about what you should eat, what you should do, how to protect your baby as it's growing and developing. So just thinking about the vaccine and wondering, what data is out there in terms of the impact to pregnancy, and even in second and third term trimesters with vaginal bleeding, and stillbirth, and other complications that women might face. So perhaps Dr. Castillo, you can start us off with this one.
Absolutely. Thank you, Val. So there is recently published a study that included at least 17,000 women, and about 8,000 of them were pregnant, mostly in the second and third trimesters. About 7,000 were lactating, and the rest were planning a pregnancy in the future. So they got the mRNA vaccine, and then they self-enrolled in a kind of on a registry where every day they were able to report any potential side effects. So every day, at the end of the day, they would fill a questionnaire. Did I get fever? Did I feel fatigue? Did I had soreness in my arm? Did I have vaginal bleeding? Did I have to go to the hospital for any obstetrical concern, etc.? And actually that study, that registry was put together by women's health researchers from the University of Washington. And what that study showed is that actually pregnant people tolerate the mRNA vaccines better than people who is not pregnant. So specifically, they were able to compare people who got the vaccine when they were pregnant versus people who got the vaccine when they were breastfeeding, and people who were neither pregnant or breastfeeding, but just planning to have a pregnancy. So in particular, and I know that a big concern sometimes for moms are, do I get this vaccine? Am I going to get a fever? And if I get a fever, is that going to push me into early labor? And so the very reassuring piece is that the most frequent side effects after an mRNA vaccine, like getting a sore arm, fatigue, and fever, were actually lower in the pregnant patients than in comparison to those that were breastfeeding or those who were planning a pregnancy. And in terms of the other very spooky outcomes that you mentioned, Valerie, like preterm birth or vaginal bleeding when in the second or third trimester, or stillbirth, there were no increase on the frequency of any of those events. And again, that is something as well that has been reported in terms of adverse pregnancy outcomes from the V-Safe study. And I also want to pick up on a stillbirth, Val, because you have mentioned it a couple times. As Dr. Kuret mentioned, stillbirth is fortunately a very infrequent adverse event. So we don't have any concern about the vaccine increasing the chances of a stillbirth. We certainly have a concern about the real infection, COVID-19, potentially increasing the risk of a stillbirth. I don't think the jury is out there yet, but there are large studies that are looking at very, very large numbers of women. And one of them is a study happening in Canada that is trying to capture all data on pregnancies affected directly by COVID-19. And the signal of a stillbirth has been seen in some of these big national registries and not in others. So there is a suggestion that COVID-19 infection, especially among women who get very, very sick, may increase the risk of late onset pregnancy loss, which is basically a stillbirth. In contrast, that has not been seen with the COVID-19 vaccination.
Just as a follow-up question, lots of things that have been out there is that there's not, kind of the long-term nature of the study. So maybe we can just dive into what the implications are for development of babies and how we're tracking, the healthiness of our children after they're being born. Dr. Kuret, can you talk a little bit about impact to baby?
Sure. I think it's a great question because there is both the immediate pregnancy time period that we are worried about and want to make sure that what we're doing is safe in pregnancy. But then I think we often look at things to say, well, will this have some sort of negative long-term effect that we just don't know about? The first thing I will say is totally valid. COVID vaccine itself has not been around that long, right? So yeah, we don't have 5 or 10-year data yet. Hopefully that is coming. I know when I was speaking to one of the vaccine representatives, I actually asked the question about what kind of long-term studies are there for children, because it's a question that I've been asked as well. And I was told that certainly with Moderna, their studies looking at the outcomes for children are scheduled up to 2023. So we would have data from the first sort of 2 to 3 years of life. Beyond that, they weren't able to tell me if there was a plan for longer studies. I imagine there will be, and I would expect that there would be some of those studies in the long term. I think the other piece that Dr. Castillo and I have talked to people about a lot is that mRNA vaccines are actually not new. It's the first time that the majority of us have heard about them and that they've been commonly talked about in the news and on social media and in the doctor's offices. But the mRNA vaccine technology and that mode of vaccine has actually been used for other, to treat other infections, things like Ebola, their Zika virus. Those vaccines were mRNA vaccines, particularly the Ebola vaccines were very widely used in Africa. So we do have experience with that type of vaccine, but for different viruses. So I think that's something that's really important to keep in mind when we're thinking about long-term outcomes, that we can also draw on our experiences from other vaccines that didn't show any harm, and they were actually widely used for pregnant women because I'll say the Ebola vaccine, because they were getting so sick and the rates of mortality were high in the pregnant women who were infected with Ebola virus. So sometimes if we don't have the exact information, we can draw on our experiences in other scenarios and try to find some of the similarities to help us make those decisions. I will tell you that I have vaccinated my child who's over 12 because I believe in the vaccine in protecting my child. And from what I can understand right now, we don't have any information that tells us there are long-term negative effects. But again, that's my personal experience. Dr. Castillo, I don't know if you want to add to that as well.
I thank you, Vreni. So when people ask me, well, how do you know it's not going to affect my baby, 10 years down the road? Like, how can you tell me that it's not going to happen? And you're right. We, as you just said, Vreni, we don't have the data. We have been using the COVID-19 mRNA vaccines for 8 months, not for 10 years. From a scientific perspective, and just how vaccines work, I cannot see how the mRNA vaccine could impact long-term development of a child if a mother gets vaccinated. And we just have to go back to the principles. The mRNA vaccine is telling the immune cells in my armpit lymph nodes how to make antibodies against the COVID-19 spike protein. So that mRNA, like those instructions, are out of my body in 7 days. So that's number one. Number two, the mRNA vaccines do not get mixed up whatsoever with my own genes. The mRNA vaccines get to my cell and go to the place inside the cell where we make proteins like antibodies, but the mRNA vaccines do not get into the core of the cells where my own genes are. And then my body gets rid of that mRNA as it does every single day. So we do know that the mRNA vaccines are out of our body again in 7 days. And then when we look at the other ingredients of the mRNA vaccines, the other ingredients on the mRNA vaccines are basically lipids, not natural lipids like cholesterol that all of us have in our body, and some synthetic lipids that are part of things that we use every day. Like there are synthetic lipids in the creams we put on our faces, in foods. So if I look at the table of ingredients of the mRNA vaccines, all those things that are there are things that are part of, and are included in so many products and so many things that we use and drink and consume every day. So I really have a hard time scientifically seeing how can an mRNA vaccine that does not reach baby and that is out of my pregnant body within 7 days, and that does not mix up with my genetic material, cause long-term development or long-term issues with my baby. So, I am a mother of 3. And so I have been through separation anxiety. I have been through one child who really had a hard time learning to talk, and really caught us by surprise because the other 2 didn't have any issue with their language. I have been through, as a mother, as having very different learning styles with my 3 children. And as a mother, have I found myself, thinking, was it something I did? It was maybe because I did too much call when I was pregnant with this one. It was maybe because I was too stressed out. So as a mother, we are always worrying about what's going on with our children. As a mother, I have been there and I continue to be there. And yet, I have to take that step back and know that when my 1-year-old scream his or her lungs out, when I drop him or her off at daycare, when they chose not to do their homework, when they had trouble, and I can tell you that someone, when they had trouble with their language, it was not because of anything me and my husband did, or because the influenza shot I got myself as a healthcare worker during my 3 pregnancies.
Yeah, great. Thank you very much for it. And I want to jump in, just cognizant of time, to some of the questions around fertility and menstrual cycles. I've had a lot of conversations with my friends in this area, for sure. I know a lot of them that received the vaccine had weird menstrual cycles following. And I think that's a common theme that a lot of women are talking about. So maybe you can jump a little bit into why that might be, or how that might impact our menstrual regulation and what it could potentially mean for fertility. Dr. Kuret, do you want to go ahead?
Sure. Yeah, Val, it's a really good question. And I think that First, I'll start out by saying what's really tough is that in general, any medication trial, vaccine trial, they don't include menstrual irregularities as one of the side effects that they track, which I don't think has really become, it never has been as clear to us as it is now with the COVID vaccines and the questions that have come up. So I would say the first thing that comes to mind for me is maybe this has been more common than we think with other medications, with other vaccinations, and we just haven't looked for it. The cynical side of me as someone who has spent her medical career working in women's health is that we're always the last to be included. Pregnant women are always excluded. Wow, not a big surprise. But hopefully, all of the talk that is out there about menstrual irregularities is actually putting it on the radar of the people doing all of the studies and clinical trials to include menstrual irregularities, and not just hemorrhaging and super heavy periods that lead a woman to go to the emergency department because she's worried about how much bleeding there is, but just these noticeable differences, but not necessarily clinically significant differences. So I would say that's issue number one. And thankfully there is a physician and obstetrician or gynecologist in the US who started a study because there was talk about this. So that's ongoing right now, and it's specifically looking at menstrual irregularities that women experience when they get the COVID vaccine. Part of what we also don't know is at what point in the cycle are women being vaccinated. I think because of the rollout and the way the vaccines have been rolled out, at least initially, people were kind of desperate to get a spot if they were keen to get the vaccine, and you just got whatever spot you could get, whether that was 3 weeks from now, when you were mid-cycle or what have you. So I don't think that we have information about the irregularities and where people were in their cycle when they were vaccinated. And there is some scientific plausibility that you could have a heavier period, or maybe some spotting, irregular bleeding, or maybe even some increased menstrual cramps. And what it all comes back to is the endometrium, or the lining of the uterus. So every month as we cycle through the changes in hormone, we build up that endometrium, kind of like your grass growing on your lawn. And then when you have your period, you shed that lining, and you can think of your period as kind of the lawnmower coming and cutting that grass, and then you start all over again. That endometrial lining, some of the elements of the endometrium are also some of the same responses that we have in our immune system. And so I think the two things are certainly linked. We also see menstrual irregularities in other settings. So women who are athletes, Olympic athletes, sometimes they don't menstruate. People find that if they go on vacation and their circadian rhythm and their time difference changes, they might have changes in their menstrual period. So there are many examples where changes in our body, changes in our environment, our stress level, and affect our periods. And I think that perhaps the vaccine can as well. Having some of those menstrual changes, I think it'll be really interesting to see the data. I suspect we will find that there probably is some effect on our menstrual cycles, but having a heavier period or having more cramping doesn't mean that it causes infertility or changes how you ovulate. If you continue to have regular 28 to 30 day cycles, then you know that your body is still ovulating and that your chances of getting pregnant are no different. So that's what I would say to the menstrual question. I think there's some validity there. I think it's great that people are putting it out there. It gives us an opportunity to explore it some more.
There's some questions related to lipids and the lipids in the vaccine, and some collection of them in the ovaries, as well as other parts of the body. I'm wondering if you can address that specifically and what the purpose maybe of the lipids are in the vaccine.
So those lipids that come with the mRNA vaccine are super important. So the instructions which is actually the mRNA, so the instructions on how to make the antibodies against the COVID-19 spike protein are preserved. So literally the mRNA is in an envelope, and that envelope is made out of those lipids. So I have seen some of the concerns about those lipids accumulating in the ovaries, and again, I go back to the science and see that that is basically not possible. The amount of lipids, of those, and it's a mix, as I said, of the natural cholesterol that we have in our bodies and some synthetic lipids that are on the mRNA vaccines, is a tiny, tiny, tiny amount. And that amount, a lot of that lipid envelope is actually more or less destroyed once it gets into the immune cell. So how would that lipid envelope, that really, a good portion of which gets destroyed once it gets into the cells inside the lymph nodes under my arm, accumulate on the ovary, is an interesting theory, but it just doesn't happen. It's a tiny amount. A good part gets destroyed before entering into the lymph node cell. I don't think it's plausible that it accumulates in the ovary whatsoever.
And I'll also add to that these vaccines all had animal studies that were done, and that's routine. That any medications, before we do human trials, they do animal trials, and in those animal trials, they typically give 10 times to 100 times the dose that would be the human dose, because they want to ensure that they catch any side effects or adverse effects that could happen. And they commonly look at the major structures in those animal models, and the reproductive organs are a big one of those that they would look at. They look in the offspring, the ability to have offspring. They look directly at the animal organs, and there were also no signs that the lipids specifically in the vaccines caused any kind of abnormalities in those animal studies. So we do have that information as well.
And I'm just wondering about maybe women who have irregular periods on a more regular basis. Maybe they're concerned about fertility or struggling with fertility. What evidence do we have around the vaccine and how it might actually influence our own fertility and likelihood of getting pregnant if we're trying to conceive a child?
So I can start, and then Eliana can join in as well. It's such a big question with so much information. And so first and foremost, I guess what I would say is we have not seen in the scientific literature any information that tells us that infertility can occur after receiving the vaccine. I will also say that infertility is something that we look at with all medications, with all vaccinations, and we're pretty upfront. For instance, when you think about chemotherapy medications or things like methotrexate used for autoimmune conditions. If we're administering a medication to a woman that could have side effects or could have negative impact on her fertility or cause abnormalities in the fetus, we have a conversation with that patient. We counsel them about it. We often, at the same time, would recommend really safe contraception and reliable contraception so that we can avoid any concerns in the time period afterwards. So I would say that that's sort of thought number one. And then when people throw out infertility, I guess what I start to think about is, okay, what exactly do we mean? And how could this vaccine that's put in my arm, that's washed out of my system in 7 days, that promotes antibodies, how can that affect my ovaries or the lining of my uterus, the endometrium, or how, my ovaries release an egg and they come through the fallopian tubes into the uterus. And so, those are all intricate parts of the fertility process. And I haven't seen any information that speaks specifically to those processes that I know have to happen in order to get pregnant. And again, no, we don't have long-term data because the vaccine hasn't been around that long, but people have been vaccinated since the fall and winter of 2020. So, although it's only been 9 or 10 months, and I feel that we would see those findings more. And again, unfortunately, some couples struggle with fertility. But I would say to them that, if we're going to take as fine a look at the COVID vaccine in terms of fertility, then we need to be doing that with everything that we do. And maybe people are, but I also wonder, did you think about that when you got the flu vaccine? Did you think about that when you got your tetanus booster? We're talking so much about fertility and the rates of infertility related to this vaccine. And in my mind, there's so many other things that we can potentially put into our bodies that could actually cause harm. And with the COVID vaccine, I'm just not seeing it. I don't know, Eliana, do you have any thoughts?
Yes, yes. So, the fertility is one of my favorite. Fertility and COVID-19 are one of my favorite topics these days. So let me just break it down. So number one, the theory, or the people that raised the bell about COVID-19 vaccines, potentially causing infertility. Their theory, and again, this was a scientist who used to work at Pfizer and put it in a blog after he wasn't working with Pfizer any longer. So the theory behind on that blog that has never been substantiated. The question that this man put in the blog was that could the COVID-19 vaccines attack a protein called syncytin 1 that looks somewhat similar to the spike protein of the coronavirus. That's the rumor, he put out there as a question. And that rumor, basically snowballed. So when we look at that rumor scientifically, the syncytin protein 1 is a protein that is made by placentas. So that protein only exists in our body when we are pregnant. So how could you suffer from infertility and be pregnant, right? So the two things just don't necessarily match. Furthermore, the syncytin protein, which is the one that is made by the placenta, is similar to the spike protein of the coronavirus. So they share something like 4 to 6 amino acids out of 174. So they are somewhat similar, but there are a lot of the composition of the protein is very different in itself. So again, that really doesn't make sense. In terms of science, and scientific evidence that we have for fertility, there are more publications coming out of the infertility clinics in the US and in Israel in particular, where the fertility doctors had samples of patients who were suffering from infertility, prior to the pandemic. So they had, sperm and eggs from couples that struggled with fertility before the pandemic. And they have been able to take samples and compare samples of sperm and eggs. So they have been able to compare sperm counts on the same individual before getting the vaccine and after getting the vaccine. And they have seen that having had a COVID-19 shot does not affect the sperm count. So that's a very important point. And, so that's a piece of data that we have, because I know that there are some men that are extremely sensitive about the fertility, and they are very, very vociferous on social media. And in terms of eggs, there are also at least a couple of studies that have looked at the eggs in vitro, and they have looked at those eggs and have put the egg in a soup, more or less, or on serum of women who have been vaccinated against the COVID-19 vaccine and have taken eggs and put them inside the serum or in contact with serum of women who have not had the COVID-19 vaccine. And they have not seen a difference on what happens to that egg. So to summarize, the whole concern about fertility came out of a blog that snowballed. There was no scientific data behind that concern. And biologically, and the theory was, well, if you get vaccinated against the COVID-19, then you will become infertile. But if that would be true, given that the syncytin protein is a protein that only happens in pregnancy, it just doesn't make sense, because people has continued to get pregnant in the pandemic, even though this syncytin protein looks relatively similar to the COVID-19 spike protein. So on this one in particular, and with everyone else, again, more than anything, as a mother myself, I really ask my patients and my friends and my neighbors, what is really behind our concerns behind the COVID-19 vaccination? We can't play the fear game on either side, right? I can come up with 150 pieces of data, et cetera, about, to make the case that the COVID-19 vaccines cause infertility. And likewise, someone else can come up with 150 reasons for which the COVID-19 vaccines don't cause infertility. I think in a lot of those discussions, we really have to ask ourselves, what is it that we are so scared about? That's number one. And number two, we really have to ask ourselves, what's a fact and what's a story? And if any of you have the opportunity to talk to a family, to a mother, to a father who have suffered from COVID-19, that is real. All these syncytin 1 amino acids, different lipids accumulating in the ovaries, that could be possible, but it's not a fact. And when we are under the duress of a pandemic, for example, and where uncertainty is filling our hearts, we can interpret data in a very different way. So really, really ask yourself, what is it that you are so worried about? Because when we are especially when we are pregnant, our mama bear sense is up here, right? We enter on protection mode. We want to do everything possible to make everything go the right way and possible, and so our fear and our reservations are up here. For those of you who are thinking of getting vaccinated, as a mother, as a doctor, and as a scientist, I can tell you that the facts about what COVID-19 can do to a mom, to a young baby, to a family, it's real. That's a fact. And we can make a lot of stories around it.
Yeah, I wanna jump into that because I think some people are asking, well, what's the alternative of not being vaccinated? But first, I want to make sure we address some of the questions on breastfeeding, because there is a lot of moms here that are very concerned about that. So if they're receiving a vaccine either during pregnancy or after they've had a child and are breastfeeding, can you touch on how that antibody might be passed to their baby, or if it would be, or if there's risks to their baby if they are breastfeeding, and what options they should think about?
So we encourage women to still be vaccinated if they're breastfeeding. It's safe to breastfeed after receiving the COVID vaccine or after having had it in your pregnancy. And again, it goes back to, as Dr. Castillo described in such a lovely way, that it's not the vaccine, it's not the medicine that goes through the breast milk that the infant would ingest. It's an antibody. It's a little bit different. Our placenta, or our body, makes various different antibodies. IgG antibodies are the ones that cross the placenta and provide the immunity to the fetus when it's still in the uterus. We make IgG antibodies for any virus that maybe we caught just naturally or that we've been vaccinated against. The antibody that is in the breast milk is IgA antibodies, and again, it is just the natural immune response that our body makes, similar to the antibodies we would produce after we've had a common virus, and that immunity is passed to the baby through breast milk, and that's one of the underpinnings of why breastfeeding is so encouraged and why breastfeeding is so important. Not only does it provide all the nutrition for the baby, it's readily available, it doesn't cost anything, but we've always known that it actually gives immunity passively through the breast milk to these young infants who are too young to be vaccinated, but can get very sick if they get infected. So this, the COVID vaccine is no different than our prior understanding of why breastfeeding is so important and helpful in pregnancy. And I would encourage women who are postpartum and breastfeeding to also consider the vaccine because it could be a really great option.
There is a study that came out in June and again, it was a study done in the United States in one single institution, but it's a big hospital in the United States that delivers a lot of babies. And they were able to, again, compare mothers who had COVID-19 infection during pregnancy, and mothers who actually were vaccinated against COVID-19. So what they did is that once babies were born, they took blood samples from babies to look for the IgG antibodies that Dr. Kuret was mentioning. So kind of the antibodies that are in the liquid antibodies that are in blood. And they also took samples of breast milk in both groups of mothers, like mothers who had the real COVID-19 infection and mothers who had the COVID-19 vaccination. And they look for the antibodies in breast milk against COVID-19. And what the study showed is that the quantity and the quality of antibodies against COVID-19 were higher in the blood of babies whose mother was vaccinated, and as well compared to those mothers who had the real infection, but as well the quantity and the quality of the IgA antibodies, that kind of the mucosal antibodies, the ones that we give babies through breast milk. Those IgA antibodies were also of higher quantity and of higher quality in the group of moms who had got the COVID-19 vaccination compared to the mothers who had got the COVID-19 infection. So that is a very good piece of data, because I have had some mothers who ask me, well, I had, COVID-19 infection. Do I need to get vaccinated, right? If I already have the antibodies and I am passing my natural antibodies, from the COVID-19 infection, I'm passing them to baby. Do you really recommend the vaccination? And my answer to those moms is yes, and please. And the yes is because, as I just mentioned, we have evidence that actually the antibodies that you get from the vaccine are better quantity and better quality from the vaccination than from the infection itself. And number two, based on our own Alberta data, we have a handful of mothers that we know got COVID-19 in the second wave. So we do know that they got COVID-19 infection with the baseline variant that was circulating in November, and they were early in pregnancy. And then in the third wave, when it was the Alpha or the UK variant circulating, we saw a handful of those moms that had COVID-19, 6 or 7 months before. We saw them getting infected again with the new variant of COVID-19. And then it happened when they were very close to giving birth. So having had that infection with one variant of COVID did not prevent them from getting infected actually at a potentially more dangerous time in pregnancy with a different COVID variant. So if, for example, a mother, tells me, oh, listen, I got COVID-19, in the spring, when I was 10 weeks and, I'm fine. I just got the sniffles. Should I get vaccinated now that the Delta variant is circulating? My answer is yes, and please. Because when we are looking at these viruses, that every new variant we get just seems to be worse. And if you get vaccinated against COVID-19, your chances of getting sick when you are breastfeeding and passing the infection to your baby would be far lower. And number two, there are no vaccines for your newborn baby. So the best way to get protected is to get vaccinated.
So the Delta variant has been hard for pregnant women. I don't know if you have any reasons why, or if you can comment on why that is the case, but particularly as it relates to the health of our pregnancy, or even the long implications fertility or any other implications. If we do get COVID and it turns out to be bad, and we might need to be in the ICU, what are you seeing amongst pregnant women in terms of the effects of COVID on them?
This is the part, Val, where it's heartbreaking to be a clinician, any healthcare worker who is working with individuals who are really sick, and it takes it to a whole other level when it's a pregnant woman, because it's not just one life we're worried about, it's two. And we know that your fetus and your infant is at risk if the mom is very sick, because the mother is essentially the life support system for the fetus. What we have seen throughout all of the waves, and even worse now in the fourth wave across Canada and in Alberta. So Dr. Castillo and I are the leads for the province of Alberta, but we work with our colleagues from every province and territory in Canada, and we're looking at infection rates, outcomes, and we definitely are seeing that when women get severe disease, they are more likely to be hospitalized. If they're pregnant and have a COVID infection, they're more likely to be in the ICU. They're more likely to be intubated. And in particular, those at greater risk are women who might have other conditions alongside their pregnancy. So if they have high blood pressure or diabetes, if they perhaps carry a little bit of extra weight and have an elevated BMI, if they have any kind of chronic illness, that's not really different than the general population, where we're seeing that comorbidities or additional chronic illnesses certainly make that worse. I would add that we've seen that consistently with COVID and pregnancy throughout Canada, and that's been amplified in wave 4 because it is more contagious, and we are seeing more women who are getting this variant become very ill. And so that, to me, is the risk. If you're choosing not to get vaccinated, then you have to recognize that if you get the virus and you are infected, your chances of becoming sick and being very sick that can have a lasting impact on you and your infant are significant. And I will say that the pregnant individuals admitted to the ICU are not vaccinated in this fourth wave. Not any of them have even had a single first dose. So that's not a made up statistic. That's just what we're seeing. And there's no value or no judgment to that. It's just what I'm seeing is that when you're not vaccinated in pregnancy and you get really sick with COVID, it often leads to intubation and an ICU stay. And then I'll say the other thing that we're seeing with all of these women who are hospitalized or in the ICU is preterm delivery. Again, we saw the baseline rate of preterm birth in Alberta is about 8%. Throughout the whole pandemic across Canada, we've seen that the preterm birth rate is closer to 12 to 13%. And that rate now in the fourth wave, Alberta specific, from the data that Dr. Castillo and I are looking at real time over the last couple of weeks, we are seeing that rate is upwards of 14 or 15% of preterm birth for our women who have been infected with the Delta variant in this fourth wave. The last thing I want to put out there too is that something that we're finding is women seem to be doing okay with if they're infected, and then all of a sudden they deteriorate and they have these symptoms that come on really quickly. So maybe more of a public health announcement and maybe not related to vaccination, but if you are sick with COVID and you're starting to feel worse, please make sure that you check in with someone or go to the emergency department, because we are seeing women who are more sick, and the change in their status happens a lot quicker. So sorry, that might have been a little bit off topic there, but I think it's really important for people to know as well.
And Val, if I may add, during the first, the second, and part of the third wave, if I look at the Albertan mothers who went to the intensive care unit during the first, the second, and the third wave, so some of those traditional risk factors were there. So, if mothers who had diabetes or high blood pressure, or they had obesity, so they were certainly overrepresented. With the Delta, I don't think that necessarily is going to hold. During the fourth wave, we have had a few moms who are not on the third trimester. Actually, they are in the early part of their pregnancy, getting so sick that they need to go to the intensive care unit. We also have had young, healthy mothers who might be going through their first pregnancy, who might be in their early 20s, no diabetes, no hypertension, no obesity, no nothing. Young moms, first, second, third baby, they make it to X amount of weeks, they get COVID, and they get very sick and go to the intensive care unit. So if for one reason or the other you choose not to get the vaccine at this stage, please wear your mask. Please keep social distance. And if you think that you're sick, please get tested.
I just want to kind of wrap up with one last question, I guess, talking about safety. We've talked a lot about mom. Through some of the conversation, we've talked about baby as well. But I want to talk about something that's out there, mostly pertaining to breastfeeding, and that is the impact that it has on babies, I guess. Some reports of blood clotting, of severe rashes. So I'm just wondering if you can touch on what you know about that, and any reports on that with regards to babies. Dr. Castillo, do you have any thoughts on that?
Sorry, Val, can you clarify the question? So do we know if the infection or the COVID-19 vaccine causes rashes in the babies, etc.? Can you please clarify?
I think the question is pertaining to getting vaccinated while breastfeeding, and any response that the baby might have, negative response the baby might have to the vaccinated mother getting vaccinated and then passing something on to the baby. So
if the question is, if a mother gets vaccinated when she's breastfeeding, are the chances of her baby getting a rash or an adverse reaction because she got the vaccine? Very unlikely. And it just goes back to the principle that we discussed right at the beginning: is the vaccine goes in here, it stays in the arm, and it is the immune reaction, is basically the protective antibodies that the mother makes. Those are the ones that would be passed on to baby. So again, when we are breastfeeding, we are always very leery that anything we do as mothers is going to impact baby. So I can, so don't eat broccoli, don't eat this, don't eat that, because baby's going to get gassy. Don't do this and because, baby, that's going to make baby colicky. Don't do A, B, and C because baby's not going to sleep at night. I remember with my first child. Anyway, it was crazy. But again, going back to the science, there is no strong scientific reason for which especially with the way the mRNA vaccines work, that would cause untoward or severe side effects on baby. And if I may just add one thing in terms of fertility, I have yesterday, as I saw a very, very dear patient whom I have met through her prior pregnancies, who actually is pregnant with baby number 4, having had her 3 prior babies all through in vitro. So she had 3 in vitro babies. This summer, she got her first dose of the vaccine. Then she got the second dose of the mRNA vaccine. And 2 weeks later, she conceived and is happily pregnant, going through her first trimester. So for those moms out there who are very, very worried about the vaccine affecting their fertility, I can tell you that I personally know someone who couldn't get pregnant for many, many years and had 3 in vitro fertilization babies and is pregnant now after having had the mRNA vaccine that is worrying so many moms out there and so many young women in terms of their fertility.
I guess just to wrap up, I wanted to ask you guys if there's any resources that you would recommend to people. I know we talked about a great resource by Dr. Jen Gunther, and I was wondering if you'd recommend any that people look into.
Absolutely. So, and by resources with reliable information about the vaccine and breastfeeding, we recommend like ACOG, the American College of Obstetricians and Gynecologists of the US, has a very nice patient interface that I would certainly recommend. I also have to say, if you follow us on social media, on our social media platforms, PEMBA, PEMBA, Protecting Every Mother and Baby Alberta, has also developed some resources, and you can find testimonials about real moms who have chosen to get vaccinated during pregnancy or breastfeeding and are there to share how their experience has been with the vaccine. And I have to say another resource is called Mother to Baby. Very good information around vaccines and vaccine safety and in general safety of medications in pregnancy.
The other thing that I wanted to add is that we have a Canadian study that is looking for women who are pregnant or breastfeeding, both women who have chosen to get vaccinated and those who have decided not to get vaccinated. It's called Covered, COVERED, and you can register your interest, and it's looking at attitudes around a vaccination, including fears, concerns, hesitations. It's looking at the effectiveness of the vaccine and some adverse events or outcomes. So if you want to be part of the information that we're gathering in Canada, that is, we can post that up as one of the resources, and it's a place that you can access, and it's open to anyone. And I think that's a great place as well to go.
That is wonderful for people that are interested. We will send out a number of the links following this session. And I want to thank our panelists tonight, Dr. Castillo, Dr. Kuret. Thank you so much for your time. Calgary Health Foundation is actually the primary funder of some important work they are doing in tracking the virus and the impact of the vaccine here in Alberta on pregnant women. So a great example of some of the investments that are helping inform our care. Just a reminder, this webinar will be available on Calgary Health Foundation's YouTube channel. And there is a number of education videos there as well that you might be interested. So thank you for joining us again, for all the wonderful questions that we had tonight, and have an excellent evening.
Thanks so much.
Thank you, everyone.